My successful knee surgery has meant that I have a life again and I can do all of those things that a 67-year-old retired person can do. My name is Jenny Davis. I'm retired, I'm 67 years old and I live in Hampstead. My knee injury started in 2017 in the summer, and it started off by me not being able to walk as far as I wanted to and to be woken at night in pain.
My wife was unable to walk just even a short distance. It was a painful experience.
I went to see my GP and he advised me at first to have anti-inflammatory drugs. I was doing a lot of exercises myself, but I found that wasn't really helping. So then I went to see Tim Waters at the Spire Hospital. He examined me to see how much movement I had in my knee. He recommended that I had surgery, and then he went through all the different types of surgery that I could have. Before I had the procedure, I was hoping that I would get back to full mobility. I was hoping to be able to walk my dog again.
Friends of ours who have had knee surgery in the conventional way were suffering for months. So we were very hesitant. But after we met Mr. Waters, the surgeon, he was explaining about robotic surgery, and we were very happy to go along with the idea.
NAVIO is a robotically assisted total knee replacement system. It allows the surgeon in real time, whilst doing the knee replacement, to plan the operation, to optimise sizing, to optimise the cuts, to optimise the ligament balancing during the procedure. So when the patient's operation is over, the surgeon knows exactly where he's placed that implant, knows where the joint line is, knows the range of movement, and knows that that joint is as good as it should be.
What the NAVIO allows us to do is to, in virtual reality, position our implant, and the computer will actually tell us how stable the knee will be in any of those positions. And that is the key thing about knee replacement surgery, because we want the knee to be stable throughout its arc of movement. So the knee goes from straight to bent, and through that range of movement, we're relying on the ligaments to keep it stable during that movement. Now, depending on how we cut the bone, there may be instability, and we're trained to deal with that. But what the NAVIO system gives us is an accurate way of measuring that before we've even cut any of the bone. Jennifer's procedure went brilliantly. It went very smoothly indeed, with no issues with either the NAVIO system or the surgery itself. And the result that we got at the end of the operation was exactly the same as the planned result, so I couldn't have asked for better.
After the operation, while I was in hospital, I did have discomfort, but I found that I was immediately given exercises to do. I found that within 3 weeks I was not using crutches and I was not using a stick, and I was getting back to sort of walking further distances each day. So it was a lot better than I anticipated.
My wife feels young again, and it's amazing. We are absolutely tickle pink about the whole thing.
I feel that robotic-assisted surgery is the future. We've used robots in orthopaedics in the past, but this system is ideal because of its reliability and the results we're seeing.
At the moment, my knee is absolutely amazing. I can go up and down the stairs freely. I can walk my dog for a long time. I'm back to much better than I ever was before.